Well, thank you so much for that introduction. So, as you said, so I'm the medical director of the Sprout Clinic. We're basically a clinic that focuses on kids who are failure to thrive, or the medical term for kids who are not gaining weight, in part due to issues of hunger. And then the other 4 days a week, I work in a primary care clinic, providing well and sick care to the kids there. But there again, issues of hunger are still very much relevant. And so, as far as why I'm talking this morning, the way I see it is that we're all involved in the same business, everyone in this room. And that's the business of providing health care, or bettering the health of our community. When I mention the word health, sorry, I'm pressing things, I've actually referred to the World Health Organization definition of health, which is, and I quote, "Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity." So fortunately, here in the States, we don't see that same degree of malnourishment that we see in countries like Africa or India. Rarely. And I say rarely, not never, but rarely. But that does not mean that hunger does not affect health here in the United States. Because true health of our community is really more than just the number of kids who are malnourished to the point of almost near starvation. So my aim here is to give a brief overview in the next 15 minutes about the various effects of hunger on health in general, not just in kids, who I mostly work with, but also in adults as well. So I'm going to focus first on hunger in adults and move to hunger in pregnancy, and lastly hunger in kids. And I do want to touch a little bit on hunger and obesity and the links between that as well. The two main points that I want to address is that hunger really affects health via two main pathways. So one pathway that we always think about is the nutrient lack in diet, so what actual nutrients are causing effects on hunger. And then the second, though, a little bit more hidden, is the effects of hunger on psychosocial stress and what that does to the body as well. So looking at adults overall, we know that the main issues of health in adults is heart disease and diabetes. And there's been good studies that show that food insecurity or hunger is definitely related to increased risk of diabetes. So we know that there was a good study on Latinas, on Hispanic women, showing that regardless of waist circumference, regardless of lifestyle, regardless of employment, issues of hunger leads to an increased risk of type 2 diabetes. And I do want to say, all my sources I have on a list, and I'll give to Ms. Osborne. So if anyone wants to have a copy of the resources that I'm using, that will be available. As far as that psychosocial, sorry. Yeah, that'll wake you up. Okay, this is better. So as far as the psychosocial stress, though, for adults, so what does that cause in adults? So there is evidence that it weakens the immune system and causes also an increased resistance to insulin, which again is another factor for the development of diabetes. So overall, there are good statistical analysis that about 23% of life years lost prior to the age of 75 can be linked to income inequality, and part of that is hunger. So that's almost a quarter of years lost prior to the age of 75, which is pretty striking. Going on to pregnancy as well, so we know that pregnant women, it's important to have iron and folate levels that are adequate as well. Without that, that can be linked to increased risk of having preterm births and to fetal growth retardation, or basically not having good growth in utero as well. We know the issues of hunger in pregnancy is related to increased risk of excess weight gain and gestational diabetes. And as a pediatrician, I always get concerned about gestational diabetes in terms of the baby. So from risks ranging from the heart to the GI tract, to increase rates of C-sections and also shoulder problems with delivery. The proper nutrition in itself is important to complete pregnancy to term and also have proper weight gain as well. We know that chronic stress is related to low birth weight. And low birth weight in and of itself is also important even for adults as well. So low birth weight, a 10% increase in birth weight is related to an increased chance of graduating high school. A 10% increase in birth weight is related to a 0.5 to 0.75 centimeter increase in adult height. So it really does make a difference how these children are born for the rest of their lives. give a little bit of dollars and cents. The cost of caring for a very low birth weight baby, just for the first year of life, is about $59,730 per child, so per individual. And then focusing on kids. So I'm sorry for the kind of list here. I'm just kind of throwing out a lot of things as food for thought this morning. For kids, one of our main issues is iron deficiency. So as a pediatrician, iron deficiency is very important in those first couple of years of life when brain development is so essential for these kids for when they get older. So iron deficiency can lead to problems with cognition, with development, with attention issues as well. We know that hunger is related to a 140% increase in the rate of iron deficiency anemia in kids. 140%, almost. It's a staggering number. Again, dollars and cents, the cost of hospitalization per child for dietary iron deficiency runs roughly about $5,500 per child. And overall in 2003, looking at nutrient deficiencies for children, we had about 400 kids, and that was back in 2003 when the economy was better, 400 kids hospitalized up to the age of 5 for nutrient deficiency at a cost of about $16,000 per child. And I can divert for just a second here to give a little bit of a personal story too. In our primary care clinic, just about a couple weeks ago, we had a 3-month-old new patient who came in, was born not in Denver, near the mountains area, and really had not seen anyone since. And whether it was due to lack of familiarity with the medical system or mistrust of the medical system, the family was not on Medicaid, was not on WIC as well. And this baby came in, completely listless, very irritable. It really did look like those pictures that you see from Africa, that you see from Somalia, of kids who are basically starving. Didn't really have good eye contact, no smile or anything like that. So the family insisted that the baby was taking proper amounts of formula. They said no vomiting, no diarrhea, nothing that we can think of that really made sense for this baby, that she was not gaining weight well at all. But when we asked the family to feed the baby in the clinic so that we could watch, they reached out into their bag and grabbed a formula bottle that looked a little bit darker than the normal formula that we normally see. So after asking, basically the family could not afford the basic formulas, did not know about programs that could help with that, and were actually buying a supplement that after further research into it, I found that it's pretty common in Hispanic communities and actually is used for some weight loss in Hispanic communities. And they were only giving the baby that. So, long story short, we had to send the baby to the hospital for risk of refeeding syndrome, where she stayed for about 3 days. And refeeding syndrome is basically, it was found after World War II with Holocaust survivors, basically. So people who were malnourished to the point of starvation, were very hungry, ate right away, and then ended up that their bodies were not ready to handle that type of increased caloric load. I saw her a couple days back, and she's doing better, so she has good eye contact now and good smile, still not able to raise her head up from what I would expect. But we know that, there's that cost of the hospitalization, but there's also that cost of the development that she lost during those first couple of months of life. That's kind of, you can't put a number on it. And we do know that hunger affects that development for children, especially for brain growth. I know we're going to have our psychologist talking a little bit, so I don't want to go too much into it, but we do know that kids aged 6 to 11 have an increased risk of coming in with lower math scores and repeating a grade when they do have issues of hunger. We know that kindergartners with issues of hunger enter into kindergarten with lower math scores, and not only that, have less gains during that first year of kindergarten than their peers. And again, the same effects on that immune system for adults is also present for kids, but in kids we don't really see it with heart disease and diabetes, we see an increased risk of hospitalizations. So kids who have issues of hunger have about a 30% more likely risk of being hospitalized, and also have about a 90% more likely risk of their parents rating their health as being fair or poor itself. And so finally, just to talk a little bit about food insecurity and obesity, there are good links between this. It's a little bit paradoxical, although I'm sure everyone in this room is probably aware of the issues as well. Women who have issues of hunger are more likely to be obese or overweight. We know that kids whose families have issues of hunger anytime at the age of 3 have a 3 times more likely risk of being obese by the age of 4.5. So why do we care about this? Well, obesity is one of the major public health issues of our generation. It leads to increased risk of heart disease, diabetes, high blood pressure, joint disease, asthma, reflux. In our population of kids, we worry about issues of depression, of more withdrawal from their social spheres, and really when it comes down to it, a loss of life as well, sort of shortened life expectancy. So in conclusion, I hope I've given a somewhat of an overview of the effects of hunger and physical health. There's a quote that we have on the wall at this Sprout Clinic by Winston Churchill. It said, "There's no finer investment for any community than putting milk into the mouths of babes." And I truly believe that. I hope I did. I do want to thank you all for your attention and for your time. I want to thank Kathy Underhill and the rest of the Hunger-Free Colorado for putting on such an amazing day. I'm looking forward to it. But most of all, I want to thank everyone in this room. So I hope I didn't depress all of you with my litany of issues that can happen, but rather invigorated you, because these are really the effects that you all are battling against every day, the effects that you all are preventing every day with the good